Hello and welcome to Health Professional Radio. Thank you so much for listening today. The rise in popularity of urgent care centers raises some red flags in many people's minds, especially in the mind of our guest in studio with us today, Mr. Wayne Lipton. Our guest warns us that while urgent care is fine for patients with issues that are simple, they can actually delay care for those patients who have more complex health issues and become absolutely, sometimes life-threatening. Our guest, Mr. Wayne Lipton, has more than 35 years of experience in healthcare and business, including the past 10 years as founder and managing partner of Concierge Choice Physicians, LLC. And he's here today to talk with us about how hybrid concierge models of healthcare can support groups and institutions, and also to talk a bit about the consolidation of healthcare. How are you doing today, Wayne?
I'm doing fine, Neal. Thanks for having me.
Thank you. The consolidation of healthcare. What exactly are we talking about? I mean, different specialties under one roof, or are we talking about, what exactly are we discussing when we're talking about the consolidation of healthcare?
Well, as the government rolled out new plans that had certain benefits in vertically integrated systems and taking on risk contracts with affordable care organizations, and as it became apparent that there was going to be a shift in compensation based on quality measures, not just quantity measures, it became more important for hospital organizations and provider organizations to gobble up as much territory as possible. It was a land grab that has been going on now for, about 4 years now, and that has been a reason why many practices have been acquired. Mm-hmm. I think the other reason there's been consolidation is that many doctors and providers have, specialists in particular, have said, it's getting so complicated and the reimbursement's coming down. Let me see if I can still find a way to be compensated at a higher rate. And a lot of the institutions and larger groups are still paid at a higher rate than the smaller independents and smaller groups. And mm-hmm. so it was a way to reduce down the pain that's been felt by doctors with compensation being cut. So the consolidation has led to some very interesting built-up monopolies as well. And so while on the one hand it leads to supposedly some efficiencies of scale, which I don't believe there really are, mm-hmm. I think that it leads to larger provider monopolies, which I think will make it tougher for insurance companies to drill them down further and for the government to make their lives more miserable. Mm-hmm. To a large extent, the consolidation has led to fewer and fewer independents and small groups. So that's what I see as the consolidation effort in a sort of a global fashion.
Now, how much collaboration or consolidation between these types of entities goes on, or are we talking about each unto his own? As the hospital takes care of the hospital, urgent care industry takes care of itself, and so on.
Well, I think I'm on a board of a hospital, and the emergency room is a very strong driver of its service and what it does in the community, in this particular community. And so urgent care has a direct impact on emergency rooms. It has it's something that's been embraced by hospital systems to have effectively an urgent care arm or urgent care centers. My hospital is building an urgent care center as we speak, mm-hmm. and operating one. I think that it's just a style of delivery that is being assimilated. It's actually not just a competitor. It's a style of providing care that is become a part of larger vertically integrated entities. Again, they're still interested in capturing a particular piece of business. In order to do that, one way to do it is through urgent care business. I know a lot of hospital systems are doing that as well. So I don't think it's separate and apart. I think it's all part and parcel of this move toward consolidation. But interestingly, concierge care has, in its full model version, in its complete full version, which we do work with a number of doctors that do full services as well, they're not consistent with that type of a service. They offer an alternative, but they're a very small niche. Mm-hmm. Hybrid concierge lets the doctors continue to deliver for 3/4 of their time traditional services, or even more than 3/4 of their time. So for institutions, for large groups, for hospital systems, the hybrid concierge model offers another avenue of revenue, and that being a more private avenue of revenue versus those through third-party payers, and therefore can increment the revenue, can make the working environment much more appealing to the doctors, and becomes a great alternative to just continuing in the traditional field of trying to fight for the crumbs that are being offered by insurers and by the government plans. That actually is now being embraced by more and more systems in a test fashion now. And there's yet another interesting thing that I'll tell you about, Neal. A number of the practices that have been acquired by hospital systems and large groups were concierge style doctors, particularly hybrid doctors, and they continue to run those programs. Then we've had a number of the managers of these institutions and these larger groups say, it's a funny thing, the productivity, the economic productivity of those doctors is far superior to all the other practices that we either have or have acquired. So maybe it's time for us to roll this out amongst all our doctors because, it makes sense. We've been telling them that for years, but I think they were distracted by what was going on with the vertical integration and with ACOs and the changes in healthcare. Now, all of a sudden, they're recognizing that this is a vehicle for increasing their revenue in a very fair and equitable fashion because it's consumer-driven. It's about going to the public and asking them, would you like to participate in this? And it's a proven model.
We talked about physicians doing concierge medicine 3/4 of their time and doing traditional medicine the rest of their time, say on a daily basis.
The other way around. The other way around.
Okay,
it's 3/4 traditional and 1/4 concierge. That's a typical hybrid model. Yeah.
Okay. Now that you've set me straight, and I do appreciate that. Don't want to be wrong. And we're seeing a little bit of the congestion of the Affordable Care Act and legislation and procedures, that type of fallout. Are you saying that these new emerging models are causing less confusion on the part of those who are compensating doctors, let's say the insurance companies, or are they scrambling to keep up?
I will say this. Insurers have, and the government have a very strong interest in reducing down the cost of care. And yet, if they reduce down the cost of care, they're concerned about sort of eviscerating the quality of care. So in order to adjust for that, they're trying to build models that recognize the quality and pay a premium for quality performance. Not a very easy thing to do, not an easy thing to measure, but that's the general concept. The problem is that the reward system is very small, and their ultimate goal is still overall to reduce down the cost of care on a global way. So no matter how you cut it, no matter how you look at it, this is about saving money and the overall cost of care. Well, if the sources of revenue are a fixed circle of money, a fixed universe of money from government and from insurance companies, and you're asked to compete, you don't mind competing to try to be the best to get some incremental revenue, but it's a fixed game. And so because it's a fixed game, the hybrid concierge approach enables those providers and those groups and larger groups to say, all right, well, then we will see if we can increment our revenue by reaching out to private sources of revenue. And that's in essence what this model is all about. There's no confusion on the part of insurers for dealing with non-covered services. And if you build the programs around non-covered services, you really have no confusion whatsoever.
Right. And I understand that you have a website where we can get more information about Concierge Choice Physicians.
Sure. If you go to www.choice.md, that's our website, and we list a lot of doctors we work with in about 23 states and large groups as well. And a fairly good amount of information is on that site, or else they can call our offices and reach out to any of us.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio today with Mr. Wayne Lipton, a founding and managing partner of Concierge Choice Physicians. We've been here in studio today talking about hybrid concierge models and also talking about the consolidation of healthcare. It's been great having you here with us today, Mr. Lipton.
Thank you so much, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.